Now, we have a graphic that's going to show us some of the things that a patient may want to consider when they meet with their doctor and what it is they're actually looking for when having this breast augmentation surgery. So if you can walk us through these, Dr. Xu, that would be really helpful.
Sure. So the first thing we talked about was saline implant versus silicone implant. Biggest difference really is the natural feel and the size. And obviously, I think because it's what's called a cosmetic surgery, everything's self-paid. So sometimes people factor in the cost as well. The other thing is,
Can I ask you, what do breast augmentations run for? What are they going for these days?
It depends on where you go and who you go see. It can run from the lower to a couple $1,000s to the high end of close to $8,000 or $9,000, based on the surgeon and the facility.
Okay. So now moving on to round versus anatomical implants.
Anatomic implants, right? So the natural breast is what's called a teardrop shape, which kind of looks like this. So if you're not going for a large augmented look, this is actually a nice way just to enhancing your natural breast. But if you're going for, again, since we're in South Florida, and a big augmented, big upper pole fullness.
South Florida.
Yes, exactly, right? And then a round implant is perfect because it doesn't just increase the bottom size, increases the entire breast. So if you can actually look at the two side by side, you can see that this will project the entire breast, while this will only increase the lower pole.
Right.
And for the round implants, there's also a couple of different variations. So I brought these 3 other implants here with me.
Do we see patients still wanting that round, almost, it's an obvious implant, I feel, right, with the round one, whereas the teardrop is just such a natural.
It's actually interesting you bring that up, because I think we're going to talk about a little bit later is that why people are opting not to do the shaped implant.
Oh, okay.
Yes. But truth be told, if you have enough tissue, most of the time people can't tell the difference of what kind of implant you have.